Insomnia is a sleep disorder where a person struggles to fall asleep, stay asleep, or wake up too early and can't get back to sleep, even when they have enough opportunity to rest. It's classified into two main types: short-term, acute insomnia, which often lasts days or weeks due to stress, illness, or life changes, and chronic insomnia, which persists at least 3 nights per week for 3 months or longer. Causes range from anxiety and depression to poor sleep habits, certain medications, and underlying medical conditions. The problem with insomnia is that it disrupts the body's natural sleep architecture, the balance of deep, light, and REM sleep, leading to daytime fatigue, poor concentration, mood disturbances, and weakened immunity. Treatments include cognitive behavioral therapy for insomnia, CBTI, which retrains the brain to associate bed with sleep, as well as sleep hygiene improvements like consistent bedtimes, reduced screen use before bed, and limiting caffeine or alcohol. While sleeping pills may be used short-term, they don't address the root cause and can lead to dependency. Insomnia isn't just not sleeping well. It's a serious health issue that can increase the risk of heart disease, obesity, and mental health problems if left untreated. Sleep apnea is a disorder where breathing repeatedly stops and starts during sleep, often without the person realizing it. The most common type is obstructive sleep apnea, OSA, where throat muscles relax too much, blocking the airway. Less common is central sleep apnea, CSA, where the brain fails to send proper signals to the muscles that control breathing. These pauses in breathing can last 10 seconds or more and occur dozens or even hundreds of times per night, causing repeated drops in oxygen levels. This triggers brief awakenings that disrupt normal sleep cycles, preventing restorative deep and REM sleep. Common symptoms include loud snoring, gasping or choking during sleep, morning headaches, excessive daytime sleepiness, and irritability. Risk factors include obesity, a thick neck circumference, smoking, alcohol use, and certain anatomical features like a small jaw or enlarged tonsils. Untreated sleep apnea can lead to high blood pressure, heart disease, stroke, type 2 diabetes, and even accidents due to fatigue. Diagnosis typically involves an overnight sleep study, polysomnography, and treatment may include continuous positive airway pressure, CPAP machines, oral appliances that reposition the jaw, weight loss, or in some cases, surgery. Narcolepsy is a chronic neurological disorder that disrupts the brain's ability to regulate sleep-wake cycles. People with narcolepsy experience excessive daytime sleepiness, often feeling an uncontrollable urge to fall asleep at inappropriate times, even during conversations, meals, or driving. A key feature of narcolepsy is entering REM sleep almost immediately after falling asleep, bypassing the normal sleep stages. Some individuals also experience cataplexy, a sudden loss of muscle control triggered by strong emotions like laughter, surprise, or anger. Other symptoms can include sleep paralysis and vivid dreamlike hallucinations at sleep onset or upon waking. There are two main types: narcolepsy type 1, which involves cataplexy and low levels of hypocretin, a brain chemical that promotes wakefulness, and narcolepsy type 2, which does not include cataplexy. The cause is thought to involve an autoimmune response that destroys hypocretin-producing cells in the brain, though genetics and environmental triggers may play a role. Diagnosis requires a sleep study and a multiple sleep latency test, MSLT, to measure how quickly someone falls asleep in quiet situations. While there's no cure, symptoms can be managed with medications like stimulants to improve alertness and REM-suppressing drugs to reduce cataplexy, alongside strict sleep schedules and short planned naps during the day. Restless leg syndrome is a neurological sensory disorder that creates an irresistible urge to move the legs, often accompanied by unpleasant sensations described as creeping, crawling, tingling, pulling, or throbbing. These symptoms typically worsen in the evening or at night when the body is at rest and improve temporarily with movement, such as walking or stretching. The constant need to move can delay falling asleep and disrupt sleep continuity, leading to chronic fatigue and reduced quality of life. While the exact cause is not fully understood, RLS is linked to imbalances in dopamine, a brain chemical that controls muscle movement, as well as iron deficiency in the brain. It can be primary, inherited, or secondary. developing alongside conditions like kidney disease, pregnancy, or peripheral neuropathy. Diagnosis is based on symptom history and ruling out other causes. Treatment can include lifestyle adjustments such as avoiding caffeine, nicotine, and alcohol, improving sleep hygiene, and incorporating moderate exercise. For more severe cases, iron supplements, if deficient, dopamine-related medications, anticonvulsants, or opioids may be prescribed. Managing RLS is important because untreated symptoms can lead to chronic insomnia, depression, and overall diminished daily functioning. REM sleep behavior disorder is a condition in which a person physically acts out vivid dreams during the REM, rapid eye movement, stage of sleep, when muscles are normally paralyzed. In RBD, this protective paralysis is absent or incomplete, allowing individuals to move, talk, shout, punch, kick, or even jump out of bed while dreaming. These behaviors often mirror dream content, which is typically intense or action-filled. Episodes can range from mild to violent, sometimes resulting in injury to the sleeper or their bed partner. RBD is more common in men over 50 and can be linked to neurodegenerative diseases such as Parkinson's disease, multiple system atrophy, or dementia with Lewy bodies. Causes may involve dysfunction in brainstem regions that regulate muscle paralysis during REM sleep. Diagnosis usually requires a sleep study to confirm abnormal muscle activity during REM. Treatment often combines safety measures like padding the bedroom, removing sharp objects, and sleeping in separate beds if necessary, with medications such as clonazepam or melatonin to reduce symptoms. Because RBD can precede neurological disease by years, ongoing monitoring is recommended for early detection of related conditions. Circadian rhythm sleep disorders occur when a person's internal body clock, which regulates the timing of sleep and wakefulness, is out of sync with the external environment. The circadian rhythm is driven by the brain's suprachiasmatic nucleus and influenced by light exposure, hormone release, and temperature changes. Disruption can result in difficulty falling asleep, staying asleep, or waking at socially acceptable times. There are several types: delayed sleep phase disorder, falling asleep and waking much later than normal; advanced sleep phase disorder, falling asleep and waking very early; non-24-hour sleep-wake disorder, common in blind individuals with sleep times shifting daily; and irregular sleep-wake rhythm disorder, fragmented sleep across 24 hours. Common triggers include jet lag, shift work, excessive nighttime light exposure, and lack of daylight. These disorders affect not only sleep quality, but also cognitive performance, mood, and overall health. Diagnosis often involves sleep diaries, actigraphy, tracking movement and light exposure, or melatonin level tests. Treatment focuses on realigning the body clock using timed light therapy, melatonin supplementation, consistent sleep schedules, and strategic exposure to natural light. Without correction, chronic circadian misalignment can raise risks for depression, metabolic disorders, and cardiovascular disease. Sleepwalking is a type of parasomnia that occurs during deep non-REM sleep, typically in the first third of the night. It involves getting out of bed and walking or performing other activities while still in a state of partial consciousness. Actions can range from simple, like wandering around the house, to complex, such as preparing food, attempting to drive, or leaving the home. The sleepwalker's eyes are usually open, but their expression is blank, and they are difficult to wake. Episodes may last from a few seconds to over half an hour. Sleepwalking is more common in children, but can occur in adults, often triggered by sleep deprivation, stress, fever, certain medications, or alcohol. Genetics also play a strong role, with the condition tending to run in families. While most cases are harmless, injury risk is a concern. Sleepwalkers can trip, fall, or leave the house into unsafe conditions. Diagnosis typically relies on reported observations, and treatment focuses on improving sleep hygiene, reducing stress, and addressing triggers. In severe or dangerous cases, medications like benzodiazepines may be prescribed, but prevention strategies such as securing the home are often more effective. Night terrors, also known as sleep terrors, are intense episodes of fear, screaming, and apparent panic that occur during deep, non-REM sleep, usually within the first few hours after falling asleep. Unlike nightmares, which happen during REM sleep and can be recalled upon waking, night terrors often leave the person with little or no memory of the event. During an episode, the individual may sit upright, thrash, scream, sweat, and have a rapid heartbeat and dilated pupils. They can appear awake, but are actually in a state between sleep and wakefulness, making it difficult to comfort or wake them. Night terrors are most common in children aged 4 to 12, but can also occur in adults, often linked to stress, sleep deprivation, fever, or underlying mental health conditions. Episodes typically last a few minutes, though in rare cases they can go on longer. While frightening for observers, night terrors themselves are usually harmless unless the person injures themselves during the episode. Treatment often isn't needed unless episodes are frequent or dangerous, in which case improving sleep hygiene, managing stress, and, in severe cases, using medications may help reduce their occurrence. Sleep paralysis is a temporary inability to move or speak that occurs either when falling asleep, hypnagogic paralysis, or upon waking, hypnopompic paralysis. It happens when the brain is awake and aware, but the body remains in the muscle paralysis state that normally occurs during REM sleep to prevent acting out dreams. Episodes can last from a few seconds to a couple of minutes and often come with intense fear. Many people also report hypnagogic or hypnopompic hallucinations, vivid, sometimes terrifying sensory experiences such as feeling a presence in the room, pressure on the chest, or hearing strange sounds. While sleep paralysis itself is not physically harmful, the fear it induces can be extreme. It's more common in people with irregular sleep schedules, sleep deprivation, narcolepsy, or high stress levels. Triggers include sleeping on the back, sudden changes in sleep patterns, and certain mental health conditions. Diagnosis is usually based on patient history, and treatment focuses on improving sleep consistency, reducing stress, and addressing underlying sleep disorders. Though frightening, understanding the mechanism can help reduce anxiety about episodes, making them less likely to recur. Hypersomnia is a condition characterized by excessive daytime sleepiness, despite getting what should be adequate or even extended amounts of sleep at night. People with hypersomnia often feel the overwhelming need to nap during the day, but naps may not relieve the fatigue. There are two main categories: primary hypersomnia, such as idiopathic hypersomnia, where no other medical cause is found, and secondary hypersomnia, which is a result of other conditions like sleep apnea, depression, head injury, or certain medications. Unlike narcolepsy, hypersomnia typically does not involve sudden sleep attacks or cataplexy. Symptoms can include difficulty waking up, sleep inertia, brain fog, irritability, and trouble focusing, all of which can significantly impact work, school, and relationships. Diagnosis may involve sleep diaries, actigraphy, and sleep studies to rule out other disorders. The causes are not always clear, but disruptions to the brain's sleep-wake regulation and certain neurotransmitter imbalances are suspected. Treatment often includes stimulant medications, lifestyle changes such as scheduled naps, and optimizing nighttime sleep quality. Left untreated, hypersomnia can lead to reduced productivity, higher accident risk, and poor mental health due to constant exhaustion. Bruxism is the involuntary grinding or clenching of teeth during sleep, often occurring during non-REM stages, but sometimes linked to brief awakenings. Many people are unaware they have it until a partner hears the grinding, or a dentist notices signs of wear on the teeth. Common symptoms include flattened or chipped teeth, jaw pain, headaches upon waking, earaches, and increased tooth sensitivity. Causes are not fully understood, but are linked to stress, anxiety, abnormal bite alignment, certain medications, and other sleep disorders such as sleep apnea. Sleep bruxism can also be influenced by alcohol, caffeine, or nicotine consumption before bed. Over time, the constant pressure and friction can damage tooth enamel, cause temporomandibular joint (TMJ) disorders, and lead to chronic facial pain. Diagnosis may involve dental examination, patient history, or a sleep study if other sleep disorders are suspected. Treatment typically includes wearing a night guard to protect the teeth, managing stress through relaxation techniques, correcting bite misalignment, and reducing evening stimulants. In severe cases, medications like muscle relaxants may be prescribed short-term, but addressing underlying causes is key to long-term management. Exploding head syndrome, EHS, is a benign but startling parasomnia in which a person hears a sudden loud noise or explosive sound, like a bang, crash, or electrical burst, during the transition between wakefulness and sleep. Despite the name, there is no actual pain or physical harm to the head. These episodes can last just a few seconds and often occur as the person is drifting off or waking up. While harmless physically, they can cause anxiety, sleep disruption, and fear of going to bed. The exact cause isn't fully understood, but theories suggest brief disruptions in the brain's reticular formation, the part responsible for transitioning between sleep stages, may cause auditory neurons to misfire. Stress, fatigue, certain medications, and poor sleep schedules appear to increase the likelihood of episodes. Diagnosis is made by ruling out other conditions, such as seizures or headaches, through medical history and sometimes neurological testing. No specific treatment is always necessary, but improving sleep hygiene, reducing stress, and in some cases using low-dose antidepressants or calcium channel blockers can help reduce frequency. Education and reassurance are often the most effective approaches, as knowing it's not dangerous usually lessens the fear. Kleine-Levin syndrome is a rare neurological disorder characterized by recurring episodes of excessive sleepiness, during which a person can sleep 15 to 20 hours a day. These episodes can last days, weeks, or even longer and occur several times a year, separated by periods of normal sleep and behavior. During an episode, individuals may also experience changes in behavior such as confusion, irritability, apathy, disorientation, and sometimes excessive eating, hyperphagia, or heightened sexual behavior, hypersexuality. When awake, their cognitive function is often impaired. They may appear sluggish, have difficulty speaking, and show poor memory and concentration. The exact cause of KLS remains unknown, but theories suggest dysfunction in the hypothalamus, which regulates sleep, appetite, and body temperature, possibly triggered by infection, autoimmune response, or head injury. The condition is most common in adolescent males, though it can affect females and other age groups. There is no definitive cure. Treatment focuses on managing symptoms during episodes, often with stimulant medications to promote wakefulness and mood stabilizers to reduce episode frequency. In many cases, the syndrome eventually resolves spontaneously over years, but until then, it can severely disrupt education, work, and daily life. Nocturnal eating syndrome is a sleep-related eating disorder in which a person consumes significant amounts of food during the night, often after waking from sleep, or engages in frequent eating episodes during the evening hours. Unlike sleep-related eating disorder, SRED, where eating occurs in a sleepwalking-like state with little memory, NS involves full awareness of the eating episodes, though individuals often feel a loss of control. Common patterns include skipping breakfast, consuming less food in the first half of the day, and eating more than 25% of daily calories after dinner. People with NES often report difficulty falling asleep or staying asleep unless they eat, and they may feel distressed or guilty about their nighttime eating. The condition is linked to disruptions in circadian rhythms and hormonal imbalances involving melatonin, leptin, and cortisol. Stress, depression, anxiety, and certain medications can increase risk. Diagnosis involves sleep and food diaries, along with psychological evaluation. Treatment may include cognitive behavioral therapy, light therapy to help reset circadian rhythms, nutritional counseling, and sometimes antidepressant medication. Without management, NES can lead to weight gain, obesity-related health issues, and worsening sleep quality.